This is my case presentation. Um, I'm doing it based off of a 11-year-old female named Sally Pennington. Her name has been changed for the purpose of this assignment. And just a brief overview, I'm a BHIP intern, so I'm placed at Gateway Pediatrics, which is a doctor's office, and I do behavioral health, so mental health and behavior management, working with children, adolescents, and even their families and parents. So client information, Sally Pennington. The name obviously was changed due to confidentiality. She's an 11-year-old female. She is the middle child, so she has a 14-year-old sister and a 4-year-old sister. She comes from a military family, and she has lived in California, Hawaii, Washington, and now Salisbury. Her parents are married. Her father is in the Navy, and her mother, or Coast Guard, I believe, actually, and her mother is a stay-at-home mom. And her mom has a history of anxiety, but she's not treated for it. That family just moved to Salisbury 1 year ago, and they're still kind of adjusting. The mom said they haven't really gotten involved in much. It's been like a slow process getting adjusted to Salisbury. Sally doesn't have any formal diagnosis regarding her anxiety, but I gave her a SCARED assessment, and she scored extremely high on her SCARED assessment. She goes to Pinehurst Elementary, and she does really well in school. She has like all A's, and she does a really great job. And then according to Erik Erikson's stages of human development, she'd be in the industry versus inferiority stage. And from what I've gathered, I would say that she's achieving this goal because she's spending more time with friends, she's feeling more confident in her abilities and her intelligence. And then also for the client information, she has no history of medical issues or any concerns like that. So for some barriers on the micro level, we can talk about how there's the lack of confidence, anxiety, and adjustment. So she has really bad anxiety with test taking, with going to school. She would wake up in the morning and get stomach aches, and she'd get so sick she wouldn't either be able to go to school or she would never be to school on time. So she definitely has had some issues with that. Another micro barrier would be the adjustment of moving to a new place, making new friends. Meso, the new environment, that can kind of fall into that as well. Lack of community support and involvement. So when she last lived in Washington, she had a lot of community involvement. They lived on a base, so everybody in their neighborhood was a part of the military families, and everyone was used to that, and they don't have that here. She said most of the neighbors are kind of old, so that's kind of lacking. Macro would be that they're a military family and the stigma surrounding mental health disorders. And then going back to meso, for the lack of community support and involvement, she also isn't in any like organizations or sports, but she does want to become involved eventually. So as I just said, with interactions, she really has very few interactions due to her recent move to Salisbury. Her mom states that the neighborhood is mostly older individuals, so Sally doesn't have a lot of children in the school that she can play with. She has not gotten involved in any extracurricular activities yet because they have been settling in and they can't really decide what to do, but she's really considering doing dance, which I suggested and said would be a great opportunity for her. So she also attends middle school, and she has interactions with her, or no, sorry, she doesn't attend middle school, she attends elementary school, and she's going to be in middle school next year, so she has interactions with her peers and her new teachers, and she's looking forward to going to middle school. She has made friends at school, spends time with them outside of school. She has about like 1 or 2 really close friends that she spends time with, and when she lived in Washington, she was involved in the community with the other Coast Guard families, and they live in an area that had more families and children, and Salisbury, they're kind of lacking with that, and they don't really see the family military kind of situation that they had or that support, so it's definitely impacting the child as well as the mom, honestly, when you meet with them. So client presentation, she was dressed appropriately, her clothes were clean, weather appropriate. In the beginning, she was very shy, timid. After the initial visit, though, she ended up, having a brightened mood, and she was very, very talkative, happy. She acts very appropriate in the office. She makes eye contact, sits still for the most part, answers, responds. and she behaves very appropriately. So her mood and her appearance is spot on. Perception of the presenting problem. Sally came to the office because she felt really anxious and it was becoming too much for her to handle. So her anxiety was manifesting somatically, as I had mentioned, giving her headaches, stomach aches, making her feel nauseous. So it was impeding her from attending school. During the initial visit with the patient, her and her mother stated that she was very anxious, and the mom was like, I don't know how to help her handle her anxiety, and she kind of wanted me to help instill some learning coping mechanisms and stuff in there. So she stated that she doesn't have any strategies right now to relieve her anxiety. She just kind of lets it happen. And she did show during the initial assessment, even though she was very, very shy and timid, she did show an urgency to learn them. And it has been clear as we have met throughout the semester that she really does have a high desire to improve and for help, and she wants to, have a better well-being. So that's really obvious with her. Support systems, I think she's really, really lucky because she has a very strong support system. Her mother and father are very supportive of her. Her father is very supportive of her, and he wants her to, feel better, get better. Her older sister, is a freshman in high school, so she understands the importance of, Sally receiving this kind of help. And overall, it's obvious that she has great family support, and she only has a few friends here, but she did state that they know that she is getting help and trying to learn more with her anxiety, and they all seem really, really supportive and to be positive influences in her life. So I think that this is definitely great that she has such a positive support system, and it's one of her overall strengths. So obviously, as I say, she has a lot of strengths that will be helpful for her in treatment. So she's very smart, outgoing, kind, understanding, able to identify what makes her anxious and how this makes her feel. So she has some insight into her mental health, which will help her to tackle her anxiety better. And she has that great support system, as I mentioned, and the desire to be helped. So motivationally speaking, she's on point, and that's a really big strength of hers. So for the workers' assessment, the patient's mother has anxiety and used to be on medications, but is not anymore. So this is a factor to be considered when assessing whether the patient has anxiety. It's important to remember that the patient has moved multiple times in her life, has made new friends, had to leave old friends, has attended multiple schools. She's been exposed to a new environment here with less of the military base vibe that she was used to. Adjustment is an important factor to consider with Sally. The patient gets along well with others and has been able to make good friends. She keeps in contact with her two close friends from Washington. And socially, she does really well and has a good support system. In the beginning, the patient was given the SCARED assessment, as I mentioned, during the first or second slide. And the scores indicated that she was experiencing very, 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 very high levels. I want to say they added up to be like in the 40s, both hers and her mom's. So they were off the charts. So case plan micro, I'm going to just do an introduction, history, assessment, psychoeducation for meso, so CBT techniques, motivational interviewing, decrease our anxiety, work on controlling it. So as you see in this picture over here, that's an example of grounding exercise that I do with all of them, and this is actually Sally's favorite. So I just wanted to provide that because I gave her about a packet. I created about 12 different calming techniques, and this is Sally's hand-down favorite. I try to get her to try other ones, but this is the one she likes to go to. She said it really helps with her somatic symptoms as well. On the macro level would be referring them out to another agency if they feel that that is what they want to do, and then as well as termination. So some client tasks that I've given her were just journaling, coloring, drawing, and using the grounding technique. So just learning some coping mechanisms for her anxiety, as well as finding out what triggers it and ways to identify it. For referrals, possible referral to therapy for anxiety and coping mechanisms if needed. And I also suggested extracurricular activities such as like the dance, which she has an interest in, because I think that would be important for her moving forward. My future plans with her are to continue therapy at another agency long-term if needed. She's really improving very, very well, very fast. her and her mom have both noticed significant changes, so by the time it comes to termination, that's when we can kind of reassess whether a long-term therapy is necessary or not. And I also would love for her to continue utilizing the grounding techniques and monitoring her anxiety, which I think is something that she would 100% do, because she really does feel that she has learned more, and she loves using this grounding technique. And as a 11-year-old, is that how old she said she is right now? Yeah, 11. She is incredible with how fast she's learning and how fast she's willing to adapt and really tackle her anxiety. So I'm impressed by her fast improvement and growth and insight, and I think she is as well, and I think she's really proud of herself. So I think in the future she will be able to continue utilizing those grounding techniques and moderating her anxiety, which I think will be really beneficial for her in the long run. Alright, so assessment of practice. So over here on the far right, we have the anxiety journal. So you can't really see, but it has on one side a bunch of different things, and then you kind of identify how it reaches to your anxiety. So that's something that I've done with Sally a few times in sessions. We've wrote about her anxiety, tried to reframe it, one that we did with her a lot was, I learned this in a BHIT training. She wanted to do, so she's afraid that she was going to fail her test. So on one side of the paper, we would write, I'm going to fail my test. Like, that's what she's anxious about. I'm going to fail my test, I'm going to fail my test. Then on the other side, on the right side of the paper, we would explain why. So for example, her first one would be, I'm going to fail my test, and then the why is because it's hard. And then we do it again. I'm going to fail my test. Why? Because I don't think I know the material. And then we would end up doing it to the point where she would say, I'm going to fail my test, and she had no more reasons for why. And that was really groundbreaking and really kind of clicked for her. Like, okay, wow, like I came up with about 6 or 7 reasons of why I might fail this test, but that's it. And then we try to also do then, okay, well, why will you pass the test? Like, what's going to make you pass the test? So doing things like that with her has been really beneficial. And as a behavioral consultant in the doctor's office, I'm very lucky that I had her as my patient, because she has so much insight and she's so smart and intelligent that she adapted really well. So I was really impressed with her for that. And then on the left side, we have how to reduce test anxiety. So like I said, she has test anxiety, so I had printed this out for her as well. And it was just kind of trying to lighten the mood and get a little goofy with it, but these all seem to be really positive. We did some visualization and mindfulness in the office. At first she didn't take it very seriously. She was giggling and laughing, but after we were done and she was able to take it seriously, she did feel a lot better and said that this is something she feels she wants to do in the future. So I was pretty happy with that. And then in the middle, you can just see the moving with children, the impact on military families, so we'll go back to that in a second. So for the assessment of practice, theories and skills used, I use CBT therapy, or CBT skills, motivational interviewing, and listening skills. So I did some grounding techniques, cognitive restructuring, that worksheet where we wrote down her anxious thoughts, the I will fail the exam, and then the reasons why, and the motivational interviewing. She was already pretty motivated to get better, but we still, try to instill that empowerment and self-determination. And listening, I would reflect and clarify back to her. Ethical considerations, consent, so she's a minor, so keeping her parents informed, confidentiality, obviously, and then helping her understand the limits of confidentiality, because she did open up really quick, but it was important for her to know that, you can tell me anything, but there are limits. And HIPAA as well, because I am working in a doctor's office. So diversity considerations, the differences in life experiences. So she comes from a military family and she's used to moving around a lot, and that instability is a very common theme in her life. So just kind of diving in more on that, and as well as diversity in general. So she feels that Salisbury is a more diverse community than what she is originally used to. So I think that that's something to keep in mind with where she was living and where she'd been moving as well, moving forward with her. Policy considerations, so Gateway Pediatrics, the doctor's office obviously has policies regarding mental health and treatment, and BHIP. So one of our policies is that we can see patients 6 to 8 times for short brief intervention therapy. So that's just something that you have to consider when working with individuals and taking a case on, making sure that you can either get it done in those 6 to 8 sessions, refer them out, or that it's something that you can really work with in that short brief time. So then back to with the flag, as I had mentioned, that would go along with research considerations. So I've tried to do some research when working with her because I actually think this is a pretty fascinating topic. So I was looking at researching on the impact that moving has on a child and researching military family children and mental health disorders. So I think it would be interesting to get more information about what moving so much, even though she's moving as a family and keeping the family as, a constant, what does this impact have on a child and her relationships and her environment and her trust, mistrust, all of that stuff. So that would be really interesting to research. And then research on the military family and mental health disorders, because also going with all the moving, some of their parents are gone for months or years, and that has to really dwell on their hearts and their heads really heavy. So I think it would be interesting to kind of research a little more on the military family and mental health with children, wives, husbands, kind of looking at that in a broader aspect. And she's the only client I've had so far at Gateway that has had like the military family background. So I definitely want to continue to do some more research and look more into that with her, because as I said, I think that would be really helpful for both myself and for her moving forward. Alright, so now we are on to my questions portions of the case presentation. So for Sally, I was wondering what some other skills and strategies I could use with her could be, and other patients that have an anxiety disorder. So I work with a lot of people who have anxiety, and I kind of see myself doing the same repetitive techniques and skills and worksheets. But although they are working and seem to be improving with the client's anxiety, I would like to see, are there any other skills and strategies that I could use with Sally or with other children in specific? My second question is that, the patient comes from a military family and she's traveled and moved multiple times. I believe it was 5. This has never seemed to impact her. However, with this most recent move, she started experiencing the anxiety symptoms and somatic issues. Do you have any experience working with military families? If so, do you feel anxiety is a common thing children in military families experience? And how have you helped prepare them for future moves? If not, what challenges would you have working with someone in a military family? And then so that one I would really like feedback about, kind of, my research considerations, and then working with a young girl who is in a military family and has anxiety, and if you have any experience with that, I would love some feedback, because like I said, she's the only one I'm working with and she is doing really well, but I want to make sure that I really hit every part and I really get this covered well for her. And then my third question is that although the family has been in Salisbury for about a year, they state that they're still adjusting and learning the area. What would you suggest to help Sally overcome this adjustment and new environment better? So as I mentioned, I suggested dance, but I've never moved as a kid before and I've never experienced this kind of adversity, so I was just wondering what you guys could suggest to me to help her overcome this change and the moving, and things that would be better for, if there is a future move, like how she can prepare and adjust better and not get so anxious where she has to be missing school so much. So, alright, well, I'm looking forward to your feedback, so thanks guys.